I'm going to talk about a study on effect of educational program for national license test for professional caregiver on trainees. For background, the professional caregiver is a worker who provides physical and domestic support service for elderly in the home or institution who has difficulty in daily life due to geriatric disease such as dementia and cerebral stroke. They play the role of providing physical, mental, psychological, and social care following the instruction of physicians and nurses, meaning that they may have some effects on elderly due to their direct provision of care. Since the national license for a professional caregiver is currently issued without restriction of education level or age of the applicants, it is necessary for the education and training process to play the proper role to ensure that they provide curriculum that develops sufficient abilities and qualities of the trainees required in performing the relevant tasks. According to a previous study surveyed nursing agency operators and managers, nursing care workers, related officials, and experts. Although many caregivers were nurtured through the caregiver training program, many of them have poor basic care skills due to factors such as the educational system that lacks the link with the field, various programs of education institutions that prioritize economic profits and lack of a supervision system for such programs and deviations between education institutions. It necessitates that evaluation of the effectiveness of education program for professional caregiver measured by the improvement level of the trainees' behavior and capacity. Since the knowledge of attitudes toward elderly are very important factor in caregiving, the provision of fundamental data that can be used to adjust the content or level of training of caregivers education and to develop and amend the questions of the national license test are likely to be a useful assist in providing better care for the elderly by producing more quality workforce. So the purpose of this study was to contribute to determine the effectiveness of the national license test and revise and complement the test by investigating the level of dementia aptitude and behavior of educational program trainees for the test. For methods, design and subjects. This one group pre-test post-test study investigated the effect of educational program for professional caregiver on the trainees, geriatric nursing self-efficacy performance range of geriatric nursing learning achievement and dementia aptitude. The subjects was 43 trainees enrolled in Caregiver Education Center of K University, an institute designated as Caregiver Education located in Gyeonggi-do. Curriculum was implemented based on textbook republished in 2019, according to the course standards specified by the Ministry of Health and Welfare. A total of 240 hours composed of 80 hours for theory, demonstration, and practice, respectively, were administered. Theory and demonstration courses were provided for 8 weeks, 5 days a week, 4 hours a day. The clinic practice were provided for 2 weeks, 5 days a week, 8 hours a day. For instruments, the general characteristics, sex, age, education level, monthly income, current vocation, and motivation for joining program. Geriatric nursing self-efficacy. Geriatric nursing self-efficacy was measured using the, the inventory of geriatric nursing self-efficacy used in 2011 survey on dementia elderly. Geriatric nursing practice. This instrument developed by Che and revised by Kim measures nursing practice in terms of mental, physical, and psychological aspects of elderlies. Achievement. The learning achievement was measured using items developed by an instructor with experience of 9 years in Caregiver Education Center and validated by the 4 nursing faculties. Dementia aptitude. The dementia aptitude was measured using dementia aptitude scale developed by O'Connor and McFadden and composed of 20 items addressing dementia knowledge and social comfort. For data collection, the subjects were trainees enrolled in Caregiver Education Center of K University. For the purpose of ethical consideration, they were informed of the purpose of studies thoroughly before participation. The researchers also explained that collected data would be used only for this study, that the confidentiality would be kept rigidly, and that the subjects would be allowed to withstand their consent at any time. The informed consents were obtained and the questionnaire surveys were performed before and after education. Analysis. Data were analyzed using SPSS version. The general characteristics of subjects were analyzed using descriptive statistics, and the effects of education program or geriatric nursing self-efficacy performance range of geriatric nursing achievement dementia aptitude were tested using paired t-test. For result, most of subjects were female. The most frequent age group was those in their 50 to 60s and followed by 40 years old and younger. 40 to 60 years old and 60 years old and older. Most of them used less than 2 million won per month as a living expense. Those without experience of caregiving or those with such experience, the most common motivation for education was license and followed by job, recreation, economic aid, and recommendation by others. For the effect of education program, the comparison of scores before and after educational program for profession caregiver showed that geriatric nursing self-efficacy performance range of geriatric nursing, dementia aptitude, and achievement were improved after education compared to those before education. The mean score measuring geriatric nursing self-efficacy and performance range of geriatric nursing measuring the effectiveness of nursing performance were improved, though they didn't reach statistical significance. The mean scores of achievement and DAS measuring attitude toward dementia were improved statistically significantly. Lastly, conclusions. This study was performed to contribute to determine the effectiveness of the national license test and revise and complement the test by investigating the level of dementia aptitude and behavior of educational program trainees for the test. It was found that achievement and dementia aptitude were improved statistically significantly after completing educational program for national license test for professional caregiver, indicating that the program has desirable effect. Other two domains, geriatric nursing, self-efficacy, and performance range of geriatric nursing, reflecting the ability to apply nursing practice in caring for elderly were improved, though they didn't reach statistically significance, suggesting that some complements are needed to improve the effectiveness of the program. Thank you very much.